Hello, everyone. We're back, and we've got Dr. Ryan on the phone, taking some time out of his valuable schedule. This is actually lunch hour for him, and I'm sorry to intrude on that. But anyway, welcome to the show, Dr. Ryan.
Thanks, Mark. Good to be back.
I would say the first thing, let's get this information out there. First of all, your monthly town hall is coming up this Thursday. Is that right?
Correct. It'll be this Thursday night from 5:30 to 6:30.
All right. And so if folks would like to join in and participate in that town hall meeting, there's a lot of moving parts in this COVID-19 epidemic. And Dr. Ryan has all the latest information. You can participate in that conversation. Go on the county, clearcreekcounty.us website and hit that COVID-19 link, and you'll see an easy access link to that conversation. So let's review. I know you just talked about all this, but I'm very interested in the vaccine population. Tell us where we're at right now and where Pfizer is trying to go. With that vaccine.
Good afternoon. 200 individuals enrolled. The initial one becomes for the one in those who received the why the CDC FDA decided to approve it. It's now in the hands of another group, the logistics side, and really puts together the fact sheets to 12 to 15-year-olds. There might not be any difference. It's possible we cannot administer to the fact sheet. So that group is meeting tomorrow afternoon sometime, and so the school has had to push that until it has a fact sheet. Right now, in the middle school, and so hopefully next Monday we'll be able to get them vaccinated, and I think it'll go really long way next fall, and all that through in our clinic or next fall. Would be
100% efficacy. What concerns that were in the trials?
There effects to body aches, that sort of thing, with similar timeline of those resolving in 24 to 48 hours post-vaccination. So no difference in that in terms of symptoms or otherwise. And so that's another piece of the puzzle that the FDA considered in approving it, that there was no indications of any additional problems at all. And so they gave it the green light.
Yeah, and I heard you say that about 80 students had signed up for the vaccination on Monday. Will it be possible for students to come to school on Monday and say, we spoke, my parents and I spoke over the weekend, and now I'd like to have the vaccine. May I have one?
The challenge is this. The Pfizer vaccine needs to be stored at -80. We don't have a -80 freezer. So from the moment it's taken out of the freezer, we literally have a week to use it. And so given that we're going to likely receive it this week and use it next week, we only ordered the amount that we had indicated by people who signed up. What we're going to say to those folks who show up and say, actually, I want little Timmy to get vaccinated, we're going to send them to the Safeway in Idaho Springs. They have the Pfizer vaccine on a weekly basis. It's a walk-in clinic. They can handle, walk-ins that are there. So the opportunity for kids will still be there. We just had to be very limited because if we don't use them, we would literally have to throw them out. And so in order to minimize any sort of waste, we only ordered the amount of vaccines that we know we have arms to go into. So those kids who want it will have to go to the Safeway in either Evergreen or the one in Idaho Springs or the Walmart in Evergreen as well. So there's opportunity for them.
Well, that's good to know. Possibly you could schedule another date at the school. I'm not suggesting you have to do that, but that's certainly an option if there was enough demand, wouldn't there be?
Yeah, and so as you know, the Pfizer vaccine is a 2-dose vaccine. The second dose needs to be 21 days apart, and by then school will be out. So we're planning to have the second dose administered in Idaho Springs at the Resource Center at the Department of Health building, as we have been doing for our walk-in clinics for the last several weeks. So we'll have a special clinic for those kids who are getting their second dose. But also in the fall, before school starts, if we know that, still 30 or 40% of the population is unvaccinated, we may have another clinic then, because it may be mandated by then. If it is fully authorized from the FDA, schools can then mandate it as a requirement to go to school. So many universities are already doing that.
Well, I'll throw a personal comment out here. I think that it seems obvious that if there's a vaccine available, it should be mandated for students. That's my take on that. I wanted to ask you about younger than 12, the youngest pediatric cohort. I had read that Pfizer was initiating some clinical trials for that group as well. What can you tell us about that group?
You're correct. As usual, Mark. Right now, Pfizer has underway a clinical trial in 6-month to 12-year-olds. This one may take a little more time because typically, as you might imagine, the dose changes. For that age group, they don't get the same dosage that a middle-aged man would get. So that's one of the other pieces of information they need to determine: at what dosage are these kids getting that same level of protection that their older cohort or the oldest adults are getting. So what I understand right now is that's underway, and Pfizer is planning to submit for approval for that age group sometime in late summer or early fall, so August or September. They are also simultaneously, as of last week, applying for full authorization. So it would no longer be emergency use authorization. That process takes a good 6 months, so that's why they've already started it. But the folks, the 6 months to 12-year-olds, it likely will be they can get vaccinated sometime in the fall, hopefully in September, October at the latest. Because to our discussion earlier on the county commissioner's call, everyone under 12 still can't get vaccinated, and that's a significant portion of our population who's completely unprotected. And masks are the one way to continue to protect those kids. And as we are seeing across the state, that's the majority of outbreaks that are occurring now in the state are in elementary, middle school, and high school kids because they're unvaccinated and predominantly now in sports are not wearing masks during their sporting event. Depends on the sport, but that's where a lot of the outbreaks are occurring now in that age group. So the sooner we can get them vaccinated, the better.
Yes, I'm hoping that that process won't take any longer than 6 months. And I'm glad you brought up this emergency authorization and then the permanent authorization, or however you describe that. I think that this is a key thing. I've heard so many people who are vaccine reluctant say, I don't want to take anything that was authorized through an emergency, but my sense is that there was never any lack of confidence in the safety or efficacy of the vaccines. It was the length of the process and the sense of urgency to distribute the vaccine that led to the emergency authorization rather than the permanent authorization. Is that right?
Correct. So never at any point, either in the clinical trials and or through the regulatory review of these, were safety or efficacy ever compromised or minimized. That standard is still there. I mean, just as an example, Pfizer submitted this data that they just approved yesterday. They submitted that 2 months ago. And so the 2-month process, and normally, as I said, for full authorization, it takes 6 months. What they're cutting out of that equation is a lot of the bureaucratic hoops that have really nothing to do at all with safety or efficacy. They have more to do with regulatory rules and regulations around use of a vaccine. So there was no shortcuts taken, either in the clinical trials or in the authorization of these vaccines. The system is set up in place, the emergency use authorization, so that in situations just like this, where the need is imminent or immediate, and there is no time to wait the 6 months for a bunch of bureaucratic hoops to be jumped through, but the safety and efficacy, there's no shortcuts on that front at all.
Yeah, I was sure that was the case, but I wanted to hear it right from you. You are our local authority on those issues, of course. Now, I was listening very closely to your conversation with the county commissioners regarding the mobile vaccine clinics that you have instituted. That seems like a great convenience to the folks who might have difficulty accessing the clinic site in Idaho Springs. I know you had one over in Evergreen and one up in Silver Plume, and they sounded successful to me. I wish that would continue for some time in the future. I know you have a couple more that are scheduled in the near future. Let's talk about those.
So, we're shifting our model slightly from what we were doing for the last several months in Dumont and doing, anywhere from 300 to 600 a day. Now that we've vaccinated the majority of folks, we're now doing a little bit more targeted, neighborhood-targeted clinics. So, as you said, we were in Evergreen and Silver Plume over the last week. We have one scheduled in Empire on the 26th, I believe, and then in St. Mary's, Alice, the 22nd. So also trying to do as many Saturdays as we can, because we know folks work, and that may very well be the reason they're not getting the vaccine, because they're normally working during those hours. So we're trying to have some on Saturdays, some on off hours, and continue to do that. And move forward with that model. We know that folks are far more likely to get vaccinated if it's super convenient, like literally walk a block from your house. And we also know that transportation is a challenge for some folks in our community, and we're doing our best to make it so it's walkable. You can literally walk there. We've also, throughout the last several months, have been doing home visits and vaccinating folks in their home who are homebound or can't get out for whatever reason. So as long as we're aware of those folks, we can get a hold of them and schedule that and take care of them in their home. And we've been doing that, and we'll continue to do that over the next several weeks and months, however long it takes to get them vaccinated. But the plan is to continue to do that. Also on the discussion, as you heard, we have a data issue challenge in that a good portion of the folks who live in zip code 80439 have been attributed to Jefferson County, even though their address is clearly in Clear Creek County. I'm very hopeful in my many discussions with CDPHE in both identifying and fixing the problem. And so hopefully in the next day or two, we're going to have that fixed. And it will give us a much better sense, much more accurate number of folks who are vaccinated. We can then dig into that data and understand where people are not vaccinated. And then continue to pinpoint on those areas and hold as many clinics as needed to get everyone who wants one vaccinated.
Oh, that's a great strategy. That sounds like that could be very successful. And I was unaware that there was an open opportunity for people who were unable to access one of the sites that are available for a vaccination, that you'll actually come to someone's house. That is great. How do people who need that service access that service?
So you can call our vaccine hotline that someone answers every single day, Monday through Friday, and just let them know when you do call. Jennifer is the one who would be answering the phone. Let her know that you are homebound and you can't get out, and we will schedule one of our nurses to get out and get you vaccinated. We've done a couple dozen so far since the beginning, and continue to do some every week when we're made aware of them. So if you do know somebody who is homebound, who can't get out, also give us a call. If you know they want a vaccine and they're unable to make that call, give us a call and let us know, and we'll figure out the logistics around that.
I should have that number readily available, but I don't, and maybe you don't either. But if you do, we could share it now.
Yeah, I'm looking it up now. I don't know it off the top of my head. I should.
No, that's okay. I once read that Albert Einstein didn't know his phone number. He said, I can look that up anytime. And so you're in good company.
Oh, here I got it. Chris, our PIO, our Public Information Officer, as usual, is doing an awesome job. The number is 303-670-7528. Again, that's 303-670-7528. And that number is also on our website as well. So if you didn't get it in time, it's on our website and can get that called.
Okay, well, thanks for sharing that. I'd like to move on to the state mask mandate. My personal opinion is it's a confusing mess, but maybe you could explain in detail what the governor has said, has ordered, and what the implications are for us in our everyday activities.
Mark, I think your description is spot on. It's confusing. It's confusing for several reasons. One, we were understanding, LPHA directors, that the governor was ceding responsibility and oversight of COVID to the counties, at which point the state would sort of take a back seat and let the counties mandate and dictate what was going to happen in our specific counties. Clearly, the governor had second thoughts about relinquishing that authority and decided that he was going to come out with his own mandates and his own guidance in addition to what counties were trying to do. And as you might have guessed, it's conflicted with many counties, and counties have now had to scramble and figure out how to adjust their own plans now that the governor continues to play a significant role in mandating and dictating what happens in the state. So in Clear Creek, just as an example, we have a mask mandate. We have since the beginning, and we continue to do so, that requires masks anytime you're in a public space inside and outside when you cannot separate from individuals more than 6 feet. Many counties around us had similar mandates. We put those in effect recently, or the re-up of them, I should say, because we were under the impression the governor was going to get rid of the state mandate. The governor, in the meantime, decided unanimously that he wanted to incentivize people to get vaccinated who were not. In one way that he saw in the very narrow scope was to incentivize people by saying if you get vaccinated, you won't have to wear your mask if enough of us get vaccinated. And so put in these numbers of 80% of folks in an establishment, when you reach that threshold, you no longer have to wear a mask. The obvious question on that one is, how are you to determine how many people in the restaurant of 300 plus 70 staff are vaccinated at any given moment? And how you determine that and determine that the number is 80% is beyond me. So it's created significant confusion, not only across the state, but for specific counties, particularly ones who had no inkling towards that sort of number or that sort of model. So now what you're seeing in spades is a collision of what the governor continues and wants to do and what the counties are trying to do, given we were told we would be independently deciding these sorts of things. So, and in the discussion we had just a bit ago with the commissioners, a lot of counties, particularly Denver metro area, basically threw their hands up and said, you know what, coming up with a separate rule or trying to interpret and provide any sort of guidance of how we're going to determine if 80% of the people in this restaurant are vaccinated is not even possible. So we're going to throw up our arms and say it is what it is, and we're just going to have to let people figure out how to do it, which if you get to the end of the story is people don't know how to do it, they're not going to do it, and it's just going to be a moot point. And we're just going to continue on, but now the mask mandate is going away. So that's the problem and the reason for the confusion. It's a continuation of what we've seen for the last 12 months. I don't think it's going away anytime soon, that confusing, contradictory messaging from the state. And so we're just going to have to deal with it. We're going to, as you heard, have a discussion over the next several weeks around the mask mandate, specifically for Clear Creek County. I think, and as we'll see in the coming weeks, I'm sure the mandate outside will be lessened to the point of, if the majority of folks are vaccinated and you're outside, the potential for risk or exposure is very, very low. And it might be retained primarily only for indoor areas, public places, and that sort of thing.
All right. Well, it's just silly. I'm sorry. Take a stand. Either stay with the mask order, which is an abundance of caution, probably at this point, but the safer route if you're trying to protect public health, or just get rid of it and join the other obnoxious states that said we don't care what the science says. That's don't try and split that baby. There's no way to do it. I wanted to say that. I go to the rec center here in Idaho Springs a number of days a week, and then I have a gym in Denver I go to when I lift with my heavy lifting buddies down there. And I got an email from the Denver gym today, and here's the way they're going to do it. They're saying that if you have been vaccinated, you may enter the gym without a mask. If you have not been vaccinated, you must wear a mask. And it immediately made me think of the dilemma that we've faced the last year, which is that so many people had COVID and didn't know it, and now we're expected to know who has been vaccinated when we really don't know that. And so I don't know how to interpret that other than I assume there will be people who are unvaccinated who will say, sure, I've been vaccinated and I'm not wearing a mask. So maybe I'm going to have to drop out of that gym for a while.
Yeah, Mark, I agree. I mean, it's as I just stated, it's just created confusion. It's created, we hope that people are honest, but you might imagine that folks who don't want to get vaccinated, there's some significant overlap with folks who don't want to wear a mask. So we'll see what comes out of that. It's created a very confusing situation that public health directors were no part of creating, and we're just having to deal with in spades and trying to figure things out.
Scrambling to do the best, I'm sure. I just want to focus one more comment on this gym issue. I hear you and the county commissioners, and rightfully so, speaking about the impacts on the restaurant industry, which is a big driver in Clear Creek County. But when you're talking about health, I think the potential for spread of COVID is probably greatest in a gym. Maybe churches are in that same category. If you're singing hymns in close proximity without a mask. But I know that when I'm in the gym, I'm huffing and puffing, and I'm gasping air, and other people are doing the same around me. And even though I've been vaccinated, I feel secure in my mask, and I know that helps to protect me from my greatly diminished exposure, but still I have an exposure. And I just think that it is one of the more dangerous environments.
Yeah, I agree, Mark, and that's why capacity has been severely limited in gyms to date, in addition to requiring masks. So it's one of the places that I am really focused on in terms of keeping the mask mandate inside in public places like that. Whereas if we're getting rid of capacity restrictions, then the masks need to stay in place until we can reach a comfortable sense or comfortable level of not just self-determined vaccine status, but actual status based on the numbers that we see in the county. So it is one area that I'm most concerned about, to your point, because of the nature of what goes on there.
Okay, we're past a half an hour of conversation here, and I want to let you go and get some lunch. But at this point, I have one last question. I just want to make sure that this is clear in everyone's mind, that Clear Creek County's mask mandate remains in place for now, and you will be reviewing that with the county commissioners on a weekly basis, I think I heard?
Yes. You're correct. It's still in place. It will be for the foreseeable future. Next week, we are going to discuss the outdoor ramifications of it and whether it's necessary and continues to be so outside. And then the following week, discuss the indoor mandate and whether that needs to continue to be in place.
Okay. Well, thank you for your time, and let me give you an opportunity to add any closing comments if you'd like.
Yeah, I just, Mark, as I say every time, everyone be safe, be well. If you haven't been vaccinated, please do so. If you know someone that needs to get vaccinated who doesn't have a ride, we can also accommodate that. We have many opportunities here in the next several weeks to get vaccinated. All 3 vaccines are available in Clear Creek County, whether through public health or through the Safeway in Idaho Springs or Evergreen. And so if you do have questions or concerns about vaccine, please give us a call. We have plenty of information, plenty of people able to answer your questions. There's really no reason at this point to not get vaccinated, and we're doing everything we can to help people make that happen.
And we appreciate all of your efforts, everyone in your department who has worked so hard to keep us safe. Thank you for all of your efforts, and thanks for joining us again today, Doc.
You're most welcome, Mark. We'll talk soon.
Goodbye now. All right, that's Dr. Tim Ryan, our Director of Public Health here in Clear Creek County, a doctor of epidemiology, and we are so happy to have his expertise and knowledge to help guide us through these difficult times. I wanted to share that a vaccination line one more time with people. If you have any questions about the vaccine or any concerns that you would like to have answered, It's all on the table. You want to know when the next clinics are going to be, where they're going to be. I'm going to give you that number. It's 303-670-7528. And we once again thank all the efforts from the folks at Clear Creek County who have helped guide us through these difficult times. Thanks for joining us. We'll be back next week for more COVID update on Tuesday. Until that time, here's some pre-recorded music for your listening enjoyment.